Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons from real cases we see every day. Behind every symptom is a real story. And today's topic, back pain, is something we encounter very often. That is why we approach it from four perspectives: what the doctor evaluates, what the nurse manages during patient care, what the pharmacist safeguards for your safety, and what the dietitian supports for your health. There's a familiar way back. Pain often begins: a strain after lifting, a long day of sitting, or even poor sleep. Something is taken for relief. The pain settles and life moves on. But the pattern does not end there. The pain returns, days later, weeks later, sometimes in cycles that begin to feel predictable. But the pattern does not end there. The pain returns, days later, weeks later, sometimes in cycles that begin to feel predictable. Then something changes. The pain begins to travel from the lower back into the buttock and down the leg. It feels sharp or burning, sometimes like an electric shock. At that point, it is no longer just back pain. From a doctor's perspective, it becomes a pattern. We ask, is the pain spreading, worsening, or affecting sleep? Is there numbness or weakness? These patterns suggest nerve involvement. A condition like lumbosacral radiculopathy, commonly known as sciatica, may be present. When a nerve is compressed, it sends abnormal signals, leading to radiating persistent pain. Nerve pain behaves differently. It may persist at rest, worsen at night, and over time lead to reduced mobility, weakness, and long-term complications if ignored. Pain that travels down the leg, burning sensations, disrupted sleep, numbness, or weakness. These are not symptoms to ignore. Back pain may seem minor at first, but it can signal a deeper problem. Early recognition leads to better recovery. If your pain is persistent or spreading, seek proper evaluation. Call or WhatsApp +233 208 720 347. And remember to explore the other perspectives, because each one completes the picture.